Good evening, everybody. This is Dr. Woeller. I appreciate you joining me tonight for this topic on cellular and organ detoxification with respects to some of the health issues we see in individuals on the autism spectrum. Let's go ahead and get started. Let me expand my screen. Should have done that earlier. There we go. Okay. So before I get into the meat of the presentation, if this is your first webinar you've joined me, or perhaps you've joined me in the past, you may know that I'm very much into education. I've got a tremendous amount of material online. This is one website where you can get access to videos that I've created that are then transcribed into articles. It's all free information. You just go to autismrecoverytreatment.com. I also have a very interactive membership site where you can join on a monthly basis if you like. You have access to me on a daily basis for questions, whether it's questions on supplements, therapies, my experience with something, testing, whatever it may be. I work with people all over the world who are implementing biomedical therapies for their children. So this is a great place to access me for just ongoing questions. Also, being part of this website, you'll also have access to professional line supplements too. Towards the end of this presentation, I'm going to give you some insight into some different homeopathic remedies that are useful for detoxification that you'll have access to. And then if you want to learn more about me, my practice, my consulting services, lectures, things that I've done and am currently doing, you can visit drwoeller.com. Okay, so let's get into what we're going to be talking about tonight. We're going to talk about what is detoxification and what are the organs that are primarily involved in that. How do our cells detoxify? We'll talk about glutathione and the importance of glutathione. Why is detox so important in autism? Talk a little bit about what's called pH balance, and then we'll get into more common biomedical remedies that help and then sort of wrap it up here on these cellular and organ-specific homeopathic remedies. So detoxification simply is the removal of cellular and metabolic debris from our blood and our organ systems. And we tend to accumulate toxins that we've been exposed to, whether it's through toxins in water, food, or the environment. And so the detoxification process is a regular process of what our body is doing on a daily basis. So in order to maintain health of our tissue, health of our organ systems, we need to be able to eliminate these toxins. We know that detoxification is important from an anti-aging process. We know it helps prevent disease now and in the future. And so it's a tremendous therapy that can be implemented by augmenting the normal processes that our body already does to really optimize our health. And we see a lot of people, not only kids on the spectrum, but other patients as well, whether it's chronic fatigue or headaches or depression, whatever may be going on. People who tend to do detoxification therapy often feel tremendously better. And we also know, depending on where you live, that we're exposed to environmental chemicals, probably more so now than ever in human history. Whether it's chemicals, plastics, pesticides, certainly we know that heavy metals are a big problem in many chronic illnesses, and we see that too in autism, and these things are found again, food, water, and the environment. The preservatives in food, the additives, the artificial colors, the artificial flavors, all of these things too can have a toxicity effect on our body, and so it's difficult to get away from it 100%. And we have toxins at our home, our workplace, in schools, our parks, even natural environments are not left unscathed these days with respects to toxicity. And there's a wide variety of toxins that we're exposed to. Now I'll just touch on a few. I won't go through all of these, but organophosphates. These are fairly common in our environment. They're used in pesticides and herbicides, depending on where you live. I used to live in California, where in the Central Valley of California, through the farming communities, a lot of people are exposed to these pesticides and herbicides, and you may live in a farming area in the U.S. or worldwide. And so these organophosphates are a problem because they can cause direct damage to the brain as well as the chromosomes of the body. Vinyl chloride is something that has been associated with autoimmune disorders. It's going to be found commonly in our homes, whether it's through appliances, through computers, through home furnishing toys. So these are just a few examples here. And then, of course, when we start talking about heavy metals, we certainly know that those are a problem. Arsenic, too, is found in many different types of pesticides and fungicides. It can be found in wood preservatives, paint. Matter of fact, I'm doing some consulting work with individuals overseas in some of the Asian countries who eat a lot of rice. We know that arsenic can be found in rice, and I often see on hair analysis a lot of the kids coming from these Asian countries have elevated arsenic levels because of rice consumption. Toluene, PCBs, all of these different types of things can have a tremendous negative effect in accumulation for many individuals. We hear so much about heavy metals being a primary problem in autism, and it is a problem, but we often don't really hear much or really appreciate the significance of other types of chemical exposures that we're often exposed to, as well as our kids. And there's a wide variety of symptoms that can happen. So it's not the same thing for everybody. One person may experience a lot of headaches. Others may have more skin conditions. Others may feel more muscle or joint pain. Adults may be more prone to fatigue. We don't see fatigue that much in the kids on the spectrum, but we certainly can see skin eruptions, food sensitivities, behavioral issues that can go along with some of the toxic effects of what these environmental toxins are all about. And then, by the way, when I talk about toxins too, we know that the internal toxins that are produced just through body metabolism, yeast, bacteria, that also can add to the pool of toxicity that causes stress within the body and certainly can cause stress within the nervous system of an individual with autism. So how do our bodies detoxify? Well, we primarily eliminate toxins through 5 major systems: the bowel, the liver, gallbladder, kidney, skin, and the lungs. And when we talk about the detoxification pathways, we're primarily talking about the pathway through the liver, because the liver is like the oil filter of our body. It's not only trying to process toxins that are coming up through the digestive system, trying to gain access to the bloodstream, but it's also filtering out the bloodstream itself. And so the liver detoxification pathways are quite complicated biochemically, but in general they're broken down into phase 1 is really trying to process environmental toxins, or what's called endogenous toxins. These are toxins produced internally in our body that are more fat soluble, whereas the phase 2 detoxification is trying to deal with more water soluble compounds. So let's move on here and talk about this a little bit more in depth. So we know our digestive system takes up everything from our mouth through our esophagus, our stomach. It includes the pancreas, as well as the gallbladder and the liver, and then of course the entire digestive system as well. Excuse me a sec. Okay. So when we're talking about bowel detox, one of I think the greatest challenges for most people, and I see this as a big problem for kids on the spectrum too, is not having good, healthy bowel movements. And ideally, we should be having a bowel movement at least once per day. Sometimes more so would be great. Not loose stools, but a couple times a day would be, but at least a good, significant bowel movement once a day. And the reason for this is something called autointoxication, and that's where the bowels reabsorb toxins back up into the bloodstream. And I've seen a lot of kids have a lot of behavioral problems with respects to constipation because they're constantly in a process of recycling a lot of these bowel toxins. There's a lot of ways of dealing with toxicity in the bowel, which we'll talk about. But we certainly know that reducing infection, trying to reduce or eliminate candida, getting rid of food sensitivities that we're sensitive to, gluten and other foods, is another way of decreasing bowel toxicity. And then if we have a history of constipation, etc., dealing with things on that level, which I'll talk about here shortly. A great remedy, if we could do it, with where it flushes the bowel of old stool and toxins. A wonderful therapy, very difficult to do on kids, and particularly kids on the spectrum because of their sensory issues, their sensitivities, the anxiety. It's possible, but difficult. But that would be, if we could do colon hydrotherapy, I believe on the vast majority of kids on the spectrum, we would see tremendous shift, not only behaviorally but cognitively, language, etc. Now we certainly know that yeast plays a big role in bowel toxicity. We certainly know that the liver and gallbladder and the congestion that it takes on, not only filtering the blood but also filtering what's coming into the body from the digestive tract, is important in detoxification. And as I mentioned before, the detox pathways through the liver are really built into two different phases, phase 1 and phase 2. Phase 1 is really dealing with more fat-soluble toxins. Phase 2 is dealing with more water-soluble toxins. And the reason I highlighted phase 2 here is that it's the phase 2 that is primarily a problem in with kids on the autism spectrum, because it's the phase 2 detox that's taking into account those sulfur groups, those sulfur-containing amino acids that are so critically important for detox and are often quite deficient in autism, as well as the process of glutathione conjugation. Glutathione is the most powerful antioxidant in the body, and it's often deficient or significantly depleted with kids on the spectrum. And so if we've got depletion of glutathione, we've got poor sulfur-containing amino acids, poor sulfur chemistry, we're going to, in essence, have poor phase 2 detoxification through the liver, and the liver's just not going to function the way we would like. The other aspect of detoxification is our kidneys. We often forget about the kidneys' role in detox, but it plays a tremendous role in our overall health. It's not only there body pH by measuring what's happening through the urine and trying to prevent too much acidity in the body, because too much acidity in the body is not only stressful on the kidneys, but it causes a lot of stress in our internal body, our organ systems, etc. If you've heard about oxalates, we know that oxalates found in many different types of plant foods, grains and other almonds, etc., can cause kidney damage in many people who have kidney stones. But we do see that oxalates are also causing problems in kidney detoxification as well if they're accumulating too much, and that can also lead to some of the acidity that we see in the body. And many kids respond very well to something called a low oxalate diet by trying to reduce the level of oxalates in their diet, and we see improvements in behavior and cognition, etc. Our skin is also a major route of detoxification. We have a lot of toxins that get stored up in the subcutaneous fat, and that these toxins are released from that subcutaneous fat through sweating. And I've actually had kids who don't sweat, or they don't sweat easily. One of the greatest I think, most beneficial therapies for helping to improve detoxification in general is sauna therapy. Now, I own personally a Heavenly Heat sauna. I absolutely love it. It's been a great sauna, and I really enjoy sauna therapy. We actually have a sauna therapy in our garage, and we use it quite frequently. And it's a tremendous way of helping to remove specifically chemical toxins. People who've been exposed to chemicals, whether it's through their job or a home that they were living in, can benefit greatly by sauna detoxification. Kids on the spectrum can also benefit by sauna detox as well. You know, the level of what a child can handle as far as heat is certainly a little bit different than an adult. The nice thing about the infrared saunas is that you don't necessarily have to use extreme heat in order to induce sweating. The reason infrared saunas are much preferred from a sauna standpoint for detox is, again, you're not having to get the elevations of heat to a level that would be dangerous for a child. If you're going to go to a gym where they have radiant heat saunas, many times those sauna temperatures are upwards of 170, 180 plus, and it's just not advisable for children. The other benefit of an infrared sauna that you don't necessarily get through a radiant heat sauna is the infrared penetrates deeper into the body tissues, which then helps the release of these stored toxins directly into the sweat. And so you can actually be in an infrared sauna at a much lower, much more comfortable level and induce even more sweating and be able to stay in it for a longer period of time than in these external heat, radiant heat saunas. Infrared sauna also helps to improve microcirculation, and it's just been a great therapy overall. Admittingly, it's difficult sometimes in the beginning to get kids to want to do it because they don't want to sit in this wooden box, for 20 to 30 minutes. Or even you're getting a temperature upwards of 95, 98, or 100 degrees is uncomfortable for them. So even though it's a great therapy, it's sometimes difficult to do. And so a lot of kids just have to be warmed up to the idea, and you just have to spend a little bit of time kind of coaxing them through it. And then over time, you'll actually find some kids that really enjoy going in there. There's a lot of different varieties of programs on sauna detox. Usually when we're talking about sauna detox for kids on the spectrum, I mean doing it, 2, 3, if they can build up a tolerance level to it 4 times a week is not unreasonable. And the whole idea is to get their body sweating. And what we find with people who do sauna therapy and do infrared sauna specifically, as they start to sweat and that sweating mechanism kicks in, it becomes much easier the next time for them to sweat. So they're not having to spend as long a period of time in the sauna as they are in the initial phases. So, infrared sauna is certainly something beneficial from a detox standpoint. People often ask me, is it helpful for heavy metals? And my experience with it is it's helpful in general for detox, but as a specific agent for heavy metals, you're really going to need to get more into heavy metal detox. There's a terminology that has been coined with respects to detoxification, and that is detoxification diet. There's a lot of diets, on the market, for individuals on the spectrum, whether it's gluten casein free, GAPS diet, low oxalate, anti-yeast, specific carbohydrate diet. All of them their goal is to try to get your child to eat healthier, try to eat better, trying to remove the processed sugar, trying to remove the artificial ingredients, getting rid of the soft drinks or the caffeinated products or the hydrogenated oils. As you take on these diets and you start to remove these processed foods, these toxic foods, in essence, you are supporting your child's ability to detox better. So getting rid of the fast foods as much as we can. And this is not only for your child, but this is for yourself too. Trying to get rid of these processed foods, these fast foods, is only going to improve their health. And so certainly incorporating more organic products, more nuts and seeds, beans, free-range sources. You've probably heard these things before. This is not brain surgery here. This is not really new information. But you can think about it, because we're sometimes get so focused on what supplement to give or what therapy do I have to do. And a lot of people lose sight of the fact that just improving diet, just improving the quality of food has a tremendous effect on health. And again, our body is geared towards removing and trying to get rid of toxins. Every breath we take in oxygen and we expel carbon dioxide, because carbon dioxide to our body is a waste fuel. It's the byproduct of oxygen metabolism. We have to get rid of it. So that process, in essence, is detoxification. So when you're thinking about a diet for your child or yourself or your family, it's just really trying to incorporate more whole food, getting rid of the processed things as best you can. And there's entire websites and books on that. I won't spend a lot of time on that, but I think the dietary aspect is important. Well, what about some other things that you can do to improve your child or even your own health? And I'm a huge advocate for exercise. I'm not just an advocate of exercise for adults. I'm an advocate of exercise for everybody. It's getting the body moving. And particularly for kids, and honestly, particularly for kids on the spectrum, if you can, because exercise is a great stress reducer. It not only improves cardiovascular fitness, it's been shown to help improve brain function with respect to depression. And so it's just a great thing to do. And the other thing that I've realized is that for many kids, they're in therapy sessions all day long. They may be inside from 7 o'clock to 6 o'clock at night and not really get a chance to move, to run, to whatever they may do. And I know every kid's a little bit different as far as their abilities, but don't overlook the importance of exercise as a form of therapy for your child, getting them out moving, getting them out breathing fresh air. So huge advocate of that, and I've actually seen over the years many kids' language improve by exercise, by going to a different park, by climbing a different jungle gyms, by learning a new skill, by doing a new therapy session. It doesn't all have to be biomedicine, with respects to medication, diet, or supplements. Many times just these factors of challenging their body physically will often bring about changes from a positive standpoint neurologically. But as we move forward, we know that supplementation is an important aspect of what we do from a therapy standpoint for detoxification. And there's a wide variety of supplements that that we use. And again, if we bring this concept back to detox, we can look at a multivitamin or a multimineral as something that would help support detox. Antioxidants helping to support detox. Cod liver oil or fish oil, essential fatty acids, a probiotic can all help support detox, because when you support the biochemistry, you support the gut, you support the liver, you support all of these organ systems in the body, you're essentially making your child's body more efficient at removing toxicity. Glutathione is a huge chemical that our body needs. We already have seen in the previous discussion that glutathione is important for that phase 2 detoxification pathway in the liver, and we know that a lot of kids on the spectrum are quite deficient in glutathione, and we'll talk a little bit more about that. One of the things, from a cellular standpoint, and they've done studies on this looking at cells, is that a healthy cell it's vital, it's pliable, it's flexible. It's able to easily assimilate nutrients and get rid of the waste product that accumulates. An unhealthy cell is something that is inefficient. It either blocks the ability to uptake nutrients, it doesn't assimilate things real well, it starts to accumulate toxins internally, it starts to shrivel, it doesn't act the way or act appropriately anymore. And an unhealthy cell, unfortunately, to the immune system is going to look like a target. And so many times an unhealthy cell target for the immune system, and is one reason that many people have an upregulation in their immune activity, either driving allergy, or driving an autoimmune problem, and all of that is going to drive inflammation. So the toxicity in the body that's affecting us at a cellular level can be a trigger for inflammation, and we certainly know that that's a problem in autism because inflammation plays a major role in brain function and brain inflammation that is so prevalent in autism. So how do our cells typically detoxify? Well, one of the things that our cells detoxify is through the chemical glutathione. So if we have a deficiency in glutathione, we can't detoxify the cells too effectively. One of the other things that's involved in the detoxification process is methylation. We think about methylation chemistry when we're thinking about just methyl B12 because of speech problems or eye contact or lack of environmental awareness, but we often don't put it in context that one of the major roles of the methylation cycle is to increase chemical production that downstream supports glutathione function. And we know that glutathione is critically involved in detoxification. So we can now bring in this other concept of biomedical intervention, methyl B12, DMG, TMG, whatever it may be, as supporting the underlying methylation chemistry in this direct discussion with respect to general detoxification. And as part of this greater discussion on methylation chemistry comes sulfur chemistry, and why sulfur chemistry is so important, and the sulfur metabolism in the body of children on the autism spectrum has already been realized to often be faulty. And so because the sulfur chemistry is critically involved, again, in detox. And where does the sulfur chemistry come in play with respect to liver function? Well, it comes in the same pathway where glutathione is working, and that's that phase 2 detoxification. So the sulfur has two major components in our body. It helps to rid toxins. It also helps to maintain the proper shape and flexibility of proteins. So our connective tissue, the flexibility structure of our cells is built in or heavily influenced by sulfur chemistry. So glutathione itself is a sulfur-containing chemical. So this is why when you see a lot of supplement recommendations like MSM, methionine, taurine, cysteine, N-acetylcysteine, these are all sulfur-containing amino acids to help fuel the pool of sulfur, of that sulfur chemistry in the body. Okay, let's shift gears here a little bit and talk about pH and how you as a parent can help to try and balance your child's pH by doing some test strip analysis, and this is something you can also do on yourself as well. Okay, so the pH balance of the body essentially is a balance between a hydrogen ion and a hydroxyl ion. The pH range is quite broad, from 0, which is very acidic, to alkaline at 14. So 0 to 14 is our chart. A pH of 7 is neutral. That means you have an equal amount of hydrogen ion and an equal amount of hydroxyl ion. Essentially, pure water has a neutral pH. When the pH is less than 7, that means you have a higher concentration of hydrogen ion and you're in a more acidic state. When the pH is greater than 7, you have a higher concentration of the hydroxyl ion, and therefore you are in an alkaline state. When you're looking at a pH scale, which I'll show you here on the next slide, the pH scale is when you're going from one stage to the next, when you're going from a 4 to a 5, a 6 to a 7, a 7 to an 8, a power of 10 increase in the pH. Okay, so going from 6 to a 7 on the pH scale, you're getting a 10 times increase from the previous number. When you jump 2 numbers, you go from a 6 to an 8, it's 100 times. A 6 to a 9, it's 1,000 times change in the pH. Okay, so here's a common pH scale. If you look at 7, which is neutral, that would be where our pure water is. The human saliva can vary. It can be a little bit acidic to alkaline. The blood, the human blood, tends to be more on the alkaline side of things. You know, seawater much more so, and as you go all the way up, you know, there's a very narrow range at which our body exists in. And you go in the other direction, coffee generally tends to have an acidic pH, tea has an acidic pH, beer is acidic, wine's acidic, and then as you start moving down the scale, things become much more acidic. So the key is trying to keep a balance and trying to keep our pH range in a healthy level. The ideal human blood pH is 7.365, slightly alkaline. The human saliva generally has a pH of about 7.4. One of the things that you can do when you get these pH strips, and you can many times find these at a medical supply store, you can also find them online, is keep a chart of what your child's pH levels are over a couple-week period of time. And so you can do testing in the morning, the afternoon, and at bedtime, you know, to find out what their saliva pH is and what their urine pH is, if you can do their urine. Usually the urine you're going to do first thing in the morning, so you're mostly going to be doing a saliva pH. Most people with a saliva pH that ranges between 6 to 8 throughout the day are generally considered to have a healthy pH range. You know, as the pH to trend lower, more consistently below 7, and certainly then below 6, the greater degree of acidity that your body is dealing with. So an ideal pH on average for saliva testing would be around 7, but realize it's going to fluctuate back and forth a little bit. You might be looking at you know, somewhere between 6.8 to 7.2, somewhere around there. Okay. If you find that your child has a consistently lower reading, pH level, 6.8 and lower, and it's staying in that range, it generally means that they're they're deficient in the alkaline reserve minerals such as calcium and magnesium. Magnesium probably being the more prevalent one because a lot of people are magnesium deficient. Generally, we will see an increase in salivary pH after we eat. And so normally that pH range should actually swing upwards of about 7.8 or higher. And so, but we're not talking about something that's going to stay at that level. So there's a lot of information online. This is just a sampling of that. But again, if you're looking at what the goal for your child is to try to maintain their salivary pH throughout the day, morning, noon, and in the evening, between about 6.8 to 7.2-ish, okay? That would generally be that their body is functioning at a healthy level. If it starts dropping down too low, getting below 6.8 consistently, or you're noticing that as a trend already, then basically they're too acidic, and the more alkaline-based diet and more alkaline reserve minerals like magnesium is worthwhile to implement. Okay, so I'm going to go ahead and skip past this. And just remember that when the body is too acidic, the organ systems are stressed. The kidneys have to work harder to try to keep things in balance. The adrenals have to work harder to keep things in balance. The lungs have to work harder to keep things in balance. So we're really trying to prevent becoming too acidic, essentially. The urine pH has a much wider swing. The urine pH can vary from 4.5 to 9 depending on diet. The ideal range, and you should write these down, the ideal range for urine is between 6.5 to 7.0, 7.1, maybe 7.2. The urinary pH tends to be lower in the morning and higher in the evening. But again, the urinary pH can fluctuate, quite profoundly throughout the day, based on diet, based on metabolic byproducts that are getting produced throughout the day, based on exercise, vitamins that are taken, minerals that are taken, drugs that are taken. So you can try and regulate urine pH. I'd probably just do it in the morning as a baseline and keep a chart. But if you're going to be really trying to manage pH levels in your child, the easier way is to do the saliva. It's just take that pH strip and place it inside their mouth and try and do that 2-3 times a day and see what you get. This is an interesting chart. This just shows you, what types of foods, where they tend to fall in their own pH scale. And again, life is about balance. So if we're only eating strong acid foods, we're going to have a lot of disease. Eating strong alkaline foods, then that's not good either. We're really looking for a balance between here. As an adult, that doesn't mean you can't go have a glass of wine or have a soda periodically. But, we primarily should be eating a balance of these foods. And for our kids, obviously we're staying away from the alcohol and the soft drinks and the heavy sugar products, but a balance of fruits, meats, vegetables, etc. Unless they've got food sensitivities to those things, is where we should be, trying to keep them. So why is detoxification so important in autism? And the reality is that the vast majority of kids that I've seen on the autism spectrum tend to have ongoing bowel problems. So the bowel problems is a major contributing factor to what's going on with them physically and cognitively and behaviorally. Because the bowel issues lead to an overgrowth of intestinal bacteria, etc. The oxidative stress that is so prevalent in autism is brought about because of these toxins, whether it's internal toxins, whether it is environmental toxins they've been exposed to. The bottom line is that the kids don't have very good antioxidant reserves. They have poor methylation chemistry in general, which compromises their ability to maintain adequate levels of glutathione. All of that then leads to phase 2 detoxification problems, and it just leads to a cascade of issues where it affects them metabolically, but what's most prevalent is it affects them cognitively, it affects their language abilities, it affects their attention, their focusing, their environmental awareness, and in extreme cases, unfortunately, can lead to a lot of behavioral problems too. Now, when we're talking about methylation, if you've not looked into or are not familiar with methyl B12 therapy, I would highly recommend you do so. In my experience, the methyl B12 injections are still the gold standard. They are by far the most consistent of all the different forms of methyl B12 therapy out there. It's not to say that doing things like a nasal spray or a lollipop of methyl B12 can't be helpful, but to really get the benefits of methyl B12 therapy for autism, my experience is at some point the methyl B12 injections should be implemented. I wrote a book on the implementation of methyl B12 therapy in autism. You can access that. It's an ebook. It's immediately downloadable to your computer at methylb12forautism.com. And so just to recap on methyl B12, we know it helps with detox, we know it helps with mental processing, etc. So the main reason I brought it up here is because we know it's an important therapy and one of the primary therapies that's used in autism, but a lot of people don't understand that it is in itself a therapy for detoxification. Okay, well, we talk so much about the gut because the gut plays such a prominent role in so many different types of health issues and also in maintaining our health. And we're really talking about the lining of the gut that is so important, because we know the lining of the gut is where the immune system is living. We also know the lining of the gut is where the cells are that produce the enzymes that we need to digest our food, and the cells that are also involved in absorbing the nutrients from our food. And when we have gluten intolerance, or we've got yeast, or we've got biofilms, or parasites, or bacteria, or inflammatory bowel conditions that exist, we're going to essentially lead to a toxicity level in the gut that can be toxic to all of us, but particularly kids on the spectrum. It can be toxic to them neurologically. And so gut assessment and digestive assessment and trying to eliminate the toxins as much as possible and improve the health of the digestive system is of paramount importance for a detoxification program. The reality is that a lot of people want to just jump right into something like chelation therapy because they do a hair analysis or whatnot that shows that their child has high levels of heavy metals. And they often forget that if they don't assess the bowel and they don't look at what's going on in the digestive system, a lot of times trying to push detox in a child, whether it's through heavy metals or even sauna therapy or other types of remedies, if their gut is not healthy, or at least their gut is not being worked upon, a lot of those toxins can find themselves down in the gut and can reabsorb and stir problems. And that usually is a big issue when we have constipation. And constipation causes a backlog of flow through the digestive system. And when we're talking about constipation, most of the time people have leftover stool in their colon. We often find through x-ray analysis, we'll see kids on the spectrum have large amounts of fecal matter that's coming or being found along the descending aspect of the colon. They may have it along the transverse segment as well, or sometimes if it's really bad, you'll see it along the ascending part of the large intestine. And we've seen, unfortunately, some situations where stool can even be refluxed back up into the small intestine. And there's a concept called enterohepatic circulation. And enterohepatic circulation is that one of the roles of the large intestine is to reabsorb water to keep the body in balance from a fluid standpoint. It reabsorbs it from the large intestine, takes it back through the portal venal system, which is a venous drainage system, back to the liver. And we know that at that point things can be redistributed out to the bloodstream. So if we have constipation, that's stool that's backing up the ability of the bowel to get rid of toxins, and those toxins are just sitting in the large bowel, many times they get reabsorbed through the portal venal system, dumped back to the liver, and taken right back up into general circulation. So the digestive system is clearly linked to the rest of our body. Okay, so we have to constantly be doing our due diligence at working at a healthy detox, and autointoxication is a real problem. The reason I'm bringing this up is that the cell membranes of the body and the cell membranes of the brain are heavily influenced by fat, specifically cholesterol. And we know that fat is a perfect medium to hold on to toxins, specifically chemical toxins, because that's one of the things we know about where chemical toxins can be accumulated is in the fat tissue of the body. So what I'm trying to do here is bridge the gap of why would the gut have a direct influence on behavior? Well, it's because these toxins can not only influence the structural aspect of the brain, okay, the way the brain cells function, but they can manipulate the neurochemistry in the brain as well. And so it's very, very important when you see a lot of kids on the spectrum having ongoing bowel problems. They're often much worse behaviorally, cognitively, language-wise, social-wise, anxiety-wise, etc., when their gut is not working well, whether it's through severe constipation or constant loose stools, food sensitivities, etc. Okay, and this was actually a real picture from a child I had who had severe aggression and had severe constipation, and his aggression was significantly reduced when he was eventually able to eliminate this old stool. So there are ways of dealing with constipation, and this particular talk is not, I mean, I could do a whole subject on constipation, but this is just a few things that can be tried as a way to improve constipation for a child on the spectrum. High-dose vitamin C, to what's called dosing to bowel tolerance can be helpful, because as you take in a lot of vitamin C, your body can only absorb so much, and it can have a laxative effect. Sometimes high-dose probiotics, just increasing the amount of probiotics can actually have a laxative effect. We certainly know that magnesium citrate can be a useful remedy, because magnesium citrate is a fairly poorly absorbed form of magnesium. Magnesium has a softening, or I guess you say a relaxing effect on the bowel, and so magnesium is often helpful for states of constipation. Sometimes a combination of these things. It's not just one thing, but multiple things. I found good success with aloe vera juice, sometimes Epsom salts taken orally. I know we do a lot of Epsom salt baths with kids. Sometimes they drink the bath water, and that's not a bad thing if they have constipation. I really like True Fiber. True Fiber is a nice remedy because it's a soluble fiber, gentle, and it's easy to take, easy to mix in water or juice. In some cases, kids have such severe constipation that they do need something like Miralax or an enema. So these are just a few examples here of trying to improve, bowel function from a constipation standpoint. Okay, what are the common remedies for detox? We talked a little bit about glutathione, we talked about diet, we talked about exercise, we talked about infrared sauna. But what are some things that you can do if you're not doing them already that can help with improving the health of your child's body? I tend to use a lot of the products from New Beginnings Nutritionals. The people at New Beginnings are great. Many of them are parents themselves. They've been through a lot of this. They're very helpful and very knowledgeable. And so they have a wide variety of different nutrient packages. This is just one called a starter supplement packet that's got, some calcium, magnesium, some antioxidants, some B vitamins, some zinc, and some cod liver oil. Recently I've been using something called the Spectrum Mate starter packets. Spectrum Mate is a combination vitamin mineral antioxidant. So, going in with this option, you're reducing, in essence, the amount of supplements you're having to give your child, and they not only have capsules as well as powder versions of the Spectrum Mate, and you can go right to New Beginnings website and figure out how much to dose based on your child's weight. Probiotics. You should think about probiotics as a detox tool, because it's primarily helping the health of the digestive system. And the more healthy the digestive system is, the more functional the digestive system is, and you basically help to get rid of, trying to get rid of the poop and all that stuff that's down there, as we had mentioned before. So probiotics are a good detoxification tool. And there are various, different types of probiotics depending on what you're dealing with. This particular probiotic called Culturelle is a specific product that attacks Clostridia bacteria. If you've not done an organic acid test from Great Plains Laboratory, I'd highly recommend you do so, because you not only want to be able to assess the yeast toxins that your child may have, but you also want to see if they have elevated levels of Clostridia. And this is where the culturelle comes into play. VSL3 is another probiotic. This is much more high potency. Often VSL3 is used in the low oxalate diet to help break down oxalates. It is a therapy that's actually used in people with inflammatory bowel disease at much, significantly high levels. And it's been shown to actually help decrease an inflammatory chemical that is not only been found in inflammatory bowel disease, that can be a trigger for systemic inflammation too. And then a few bowel remedies. I mentioned True Fiber previously as a nice soluble fiber if your child has a tendency towards constipation. True Fiber is also called a prebiotic. It helps fuel, it's like a fertilizer for the probiotics, the good bacteria, so it's got a dual purpose. Activated charcoal is a nice remedy to help bind up those bowel toxins to prevent them from being absorbed. Usually a capsule or two once or twice a day is a useful, definitely a useful remedy for when you're treating for yeast or bacteria, or your child's been exposed to something, some type of food, some type of chemical that maybe they're reacting to. Activated charcoal can be used in those kinds of situations. And then, of course, we talked about glutathione and Epsom salt. I really like the lipoceutical glutathione product. This is an oral liquid glutathione. It's meant to be absorbed much more quickly and much more effectively than taking a capsule form of glutathione. Usually a 1/4 teaspoon for every 30 pounds body weight, twice per day. It's more can be used. I've used, even a half teaspoon, even a teaspoon, for 30 pounds body weight, depending on how, severe a child's glutathione deficit was. But on average, a 1/4 teaspoon for every 30 pounds body weight twice per day is a good starting dose. Epsom salt cream, this has the Epsom salt, the magnesium sulfate, nice remedy to use a couple times a day to apply to the skin, usually a teaspoon or so is a good way to go with that. That can help support detox. Okay, we're going to wrap up here on some specific homeopathic remedies that I found to be very helpful for many kids. They're nice because they're gentle, they're easy to administer, and it's just a different way of trying to address liver, bowel, and kidney detox. Members of Autism Action Plan, the membership site that I have access, because these are a professional line product only, but you can access these through the Autism Action Plan website. Okay, so just lay the groundwork here. With respects to these remedies, these things that are called cellular and organ-specific homeopathic remedies, they come from a company called BioResource Incorporated. And homeopathy has been around a long, long time. It's a concept of like cures like. And I've seen some really good things with homeopathy, over the years. Essentially what it is taking minute amounts of an animal, plant, or mineral substance that helps to promote a healing response, in essence, in a non-toxic way, okay? Spagyric remedies, and essentially these remedies that are coming from BioResource, also use the concept of spagyric. And spagyric remedies, date back to the alchemist days of Paracelsus, back to the 16th century. They're a form of homeopathy where the vital energy and the active substances are actually extracted from medicinal plants, and then through a process of what's called succussion, repotentized. So spagyric is primarily going after the vital energies of plants, whereas homeopathy may use a plant substance, but it may also use an animal or a mineral substance as well. Okay, and in this concept of these remedies coming from this particular company, there's a number of remedies that are used to address liver, lymphatic, and kidney, and they're called the big three. Okay, and so each of these things are oral drops. There's one that specifically is addressing the liver and gallbladder. Remember, the gallbladder is important. We don't talk about the gallbladder so much because we're so focused a lot of times on liver, but the gallbladder is holding the bile. The bile is important to help absorb fat-soluble vitamins. And if we don't have good bile production, we're going to have poor fat-soluble vitamin assimilation. So what we're trying to do with any kind of detox is not only support healthy gallbladder function, but healthy liver function. The lymphatic aspect of our body is critical too. And one of the things, remember I talked about infrared sauna. Infrared sauna helps to activate microcirculation in the body. That's microcirculation of the bloodstream, but it also helps to improve the circulation of the lymphatic system. The lymphatic system is like the sewage system, if you will, of our body. It's helping to circulate a lot of the metabolic byproducts that have been produced and pull it towards the bloodstream so that the bloodstream can take it to our kidneys and take it to our liver to be eliminated from the body. The lymphatic system is also one of the areas where the immune system travels. So having a healthy lymphatic system is critically important too. And then of course we know that kidney function is important because the kidneys are not only helping to regulate fluid level, they're helping to regulate pH and helping to regulate electrolyte levels in the body as well. The first remedy is called ApoHPAP. And this is primarily to support the liver and gallbladder. It helps to detoxify these organs and also helps to purify the bloodstream and support the lymphatic system as well. Renalex is specifically known to help with kidney function. And so not only just the kidneys, but the bladder and the urethra in both boys and girls as well. So the entire urological tract is involved in this complex of what we call kidney function. And so this has been something that has been used to not only help to decrease inflammation, but try to improve the kidney's ability to get rid of these metabolic byproducts that come about, whether it's from excess sugars or proteins, crystal formation, sediment accumulation, and even oxalates. And remember, the kidneys play a critical role in pH balance, as well as maintaining sodium and potassium. Arteries is specific for the lymphatic system. So the lymphatic system, again, is that sewage drainage system of the body, but it's also critically involved in the immune system as well. So, and the lymphatics play a huge role in the digestive system, okay? Because when our body is absorbing nutrients, part of what's being absorbed and absorbed through is the lymphatic system. So in order to try to avoid toxicity from auto-intoxication, the lymphatic systems many times needs that support. So Arteries is specifically for that. And there's a wide variety of other homeopathic or spagyric remedies, on the market. These are what I have used quite commonly to help sort of the big three, the gallbladder, liver, the lymphatic system, and the kidney system. There are people who specialize in these types of remedies, what's called sequential homeopathy, trying to go back in time and give specific remedies for vaccine reactions, specific remedies for chemical toxicity or insults, things that may have happened in the past to try to reduce the stress in the body from a toxicity standpoint. But the combination of these three things, in my experience overall, has been a nice adjunctive therapy for additional detox therapies that you may be doing, whether it's working on your child's gut, whether it's working on their immune system, whether it's incorporating a healthy diet and healthy supplementation to just help their body work more effectively. So, okay, so with that, I know that was a lot of information in a short period of time. If these are remedies that you're interested in learning more about and have some questions for me, want to access, then you can do so through the autismactionplan.com website. The best place to access the information, I actually have a section on that website called Biomedical Protocols, and there's an area in there for homeopathic detox and terrain remedies. You can also ask me questions specifically through the parent forum. I have a whole category, a list of categories where you can post questions that go out to the general population on the website. And if you choose, you can actually post me privately. So you can dialogue with me privately if you choose, not only about these remedies, but anything related to biomedical intervention that you may be curious with, want answers to, or want assistance with. And then finally, I'm available for private consultations as well. I do a lot of phone and internet consulting as well as in-person consults. If you want to get more information about my consulting service, you can contact my office at 951-461-4800 or email to info@mysunrisecenter.com. So with that, I hope you found this presentation useful and informative, and we will see you again. This is Dr. Woeller, and I appreciate you taking part in this tonight. Thank you.